Hi everyone, it's a real pleasure and privilege for me to be talking today with Professor Eric Klug. Eric is a cardiologist who's an associate professor in the Division of Cardiology at the University of Witwatersrand, my alma mater, works at Charlotte Maxeke Hospital in an academic capacity and in private practice at Sunnhill Hospital in Johannesburg. More importantly than all of that, and that all sounds very important, Eric was my consultant when I was an intern in the hospital, and I've known Eric as a result for 25 years. And as a patient living with a chronic cardiac condition, Eric is also my cardiologist. So Eric and I have a long-standing relationship. Eric, good to be with you.
Thank you, Ron.
So we're here on the 17th of May, World Hypertension Day, recognizing that hypertension is an insidious disease affecting about 1 billion people worldwide. So Eric, considering that most of our audience is non-healthcare experts, maybe we should start by just describing what is hypertension.
Sure, and hypertension, as you said, is very common, so we have to understand what it is. So hypertension really relates to the pressure of the blood in your vessels, and the vessels are attached essentially to your left ventricular pump chamber, and that left ventricular pump ejects blood through the aortic valve. So you can imagine it as a door that opens. And when that door opens, blood is ejected into the vessels under a pressure. That pressure is the top pressure that you get in your blood pressure reading. We call that systolic, and normally the number is about 120. Often patients will say it's 12, but there's always a zero often. So 120 will be your top pressure. And then at the end of that ejection phase, the blood doesn't get ejected anymore from the ventricle. The aortic valve closes, the door is closed, and now that blood has to be distributed through all the vessels of your body down to your toes. And that measure of that sort of distribution pressure is called the diastolic blood pressure or the resting phase blood pressure, and that number is usually around 80 millimeters of mercury. We measure blood pressure in millimeters of mercury.
So as you've described, the normal blood pressure is about 120/80. What happens in hypertension?
So the definition of hypertension is what plagues physicians. People who do blood pressure are called barologists. And it's a problem because defining the abnormality can be an issue. And so we generally define blood pressure according to the office blood pressure that your doctor takes when you visit him. And that number would be taken as 140/90 in the general population.
Now in my case, Eric, my blood pressure was high when you first measured it. And then you made me sleep with a blood pressure monitor for 24 hours. Why would you do that?
So the 24-hour ambulatory blood pressure monitor, ABPM, gives us an idea of 24 hours of coverage. Because blood pressure is very variable. If a patient is sitting in a doctor's office, especially for the first time, or a specialist office, there's nervousness, anxiety. And therefore you want to get over that so-called white coat effect. That stress may create a false blood pressure. There are other factors in blood pressure. Drinking caffeine, having alcohol, stress, emotion, pollution. There's a number of factors that affect blood pressure. And we think with a 24-hour ambulatory blood pressure, you can sort of remove all these extraneous problems and get an average daytime, nighttime, and then an overall 24-hour blood pressure. But the availability of that is not common, and it's expensive, and it's cumbersome, and it does disturb your sleep. So there's different sort of factors related to that. And therefore we tend to favor home blood pressure monitoring, that you get your own machine.
Right. So what causes high blood pressure in the majority of the population?
And that again, believe it or not, common disease, and we don't really know. We know factors that are associated with blood pressure, but the actual reason, the genetic base, the problem at the cellular level, at the sodium, potassium crossing the membranes, that we're not fully aware of or understand. But the associated factors, there are numerous that we understand.
So by implication, what you're saying is that blood pressure is essential blood pressure. It's elevated for a reason that we don't fully understand, but often in families. I mean, in my case, my late grandfather had high blood pressure and my father's got high blood pressure. So I suppose I inherited that predisposition.
Right. So there is, as in most diseases, there's a genetic base to a disease, and then there's environmental factors on top of that. So you're not destined to fulfill the prophecy of your father and your grandfather, but it's clearly, and you're very fit and you look after yourself and you eat well, but you're in a highly stressful job. So there's all these elements, So the genetics of it are important.
So Eric, how does somebody know that they've got a high blood pressure? Will they feel something? Are there signs and symptoms they could look out for?
Generally, blood pressure is known as the silent disease. I don't want to use the other term silent killer because that's dramatic, but certainly blood pressure plays a role in our sickness and dying. So it is an important condition. But generally, patients don't know they have high blood pressure, or they may have headaches, or they may feel fatigued, or they may feel their concentration isn't as good as it was. And if there's other reasons for the blood pressure, we didn't discuss what we call secondary causes. There's hormonal problems, adrenal gland problems that are rare but are present. And we know there's vascular problems in the arteries to the kidney. Those patients may have particular symptoms related to that. But generally, you can call it an asymptomatic disease, and you have to get a blood pressure reading.
Which is half the problem.
Right.
Because having a high blood pressure for an extended period that's not controlled does harm to your body.
Right.
Yet people often don't have any signs and symptoms.
Right.
And at Discovery, one of the things we're real proponents of is regular health screening.
Right.
So from my perspective, having a regular health check is critical to have a good blood pressure assessment and make absolutely certain you're not living with high blood pressure.
Yeah, it's the only way. It's a form of investing in your health, which people don't tend to take on board. When they start earning money, they're worrying about retirement, they worry about their kids, they put money away, they buy a property, but they don't think, I've also got to invest in my health. And part of that investment is like what Discovery offers and other people, where you have this preventative strategy of getting to know your numbers. That's what you have to do. Know your numbers in blood pressure, know your numbers in sugar, know your numbers in cholesterol. Get to know your numbers. And if they're normal, that's reassuring for that period of time. And then you'll get it checked again a year or 2 years later.
So, Eric, I think lots of us understand that salt in your diet is risky when it comes to blood pressure. Just talk to us a little bit about nutrition and its relationship with blood pressure.
Now, salt is a big player in blood pressure, but not every patient has a salt-related blood pressure problem. And maybe about 50% of hypertensives, people who have high blood pressure, will respond to lowering of salt in their diet. Now, salt
50% is surprisingly high to me.
Yeah, well, it's about that number, depending on what population you're looking at. And low and middle income countries, there's a lot of salt in this food that is given. The cheaper foods have a lot of salt. So the rule is really that anything that's preserved, anything that comes out of a packet, out of a tin, that you buy your food pre-made and you put in your microwave, because the preservative is sodium. Sodium something is preserving your food. And that's 3/4 of the salt in your diet. What you add to salt at the table with the shaker to your salad, I've got patients who add it to their lemon or to their orange. That's how bad some people are with their salt. But that's important, and we try and stipulate that they remove the salt shaker from the table. But lowering your salt intake, and we say a teaspoon of salt, 1.5 grams of sodium or 5 grams of salt. So it's a teaspoon actually of salt. Is your sort of daily recommendation. But just remember, the more fresh your diet, the less likely it is to be salt intensive.
How does physical activity affect blood pressure?
Moderate exercise, that's another important thing. So when we say physical activity, we don't mean excessive exercise.
Okay, so I'm gonged out here.
Right. That's why I mentioned it first. But it is important. The idea behind exercise is moderation, especially in people with blood pressure, because they found that moderate exercise contributes to your health. Severe exercise, intensive exercise, this hyper-intensive exercise, high-impact exercise, makes you fitter, makes you stronger. If you're planning to do a comrades run or a big marathon, it obviously contributes to that, a triathlon. But for ongoing health, moderate exercise reduces blood pressure.
Some of the evidence-based research I've been looking at lately speaks to high intensity interval training and importantly weight training, which used to be out of vogue,
Right.
as very important for maintaining cardiovascular health.
Right, 100%. I agree with the weight training. And so we say 150 minutes of exercise at least divided during your week of aerobic, and then twice a week at least of strength training and weight training, but then again in moderation. People mustn't feel that the guy who's going mad at the gym is healthier than the other chap who's walking around the circuit, doing his circuit in his own time, doing light weights, doing his stretches. The benefit is very similar.
So Eric, what are the long-term complications of living with a high blood pressure that's untreated?
Patients get very upset about the numbers, and there's a group of patients, when they see the number, let's say when they're checking it at home, react to that number on that day. But actually blood pressure plays its role over years. And so you've got time. There's no panic, because over the years it affects the brain vessels, so you're more prone to stroke. That can be a bleeding stroke, where you bleed into your brain, or a clotting stroke. Everybody thinks high blood pressure makes you bleed, but actually 50% of the strokes are related to clotting. So the brain is very important, stroke. Then we come down to your neck artery, which reminds us of all the arteries. And so you can have peripheral vascular disease increased by blood pressure. That means you develop plaques, narrowings in the tubes. You can imagine it like speed humps on a road. That's what happens in your blood vessels. Then you get to the level of the heart, and now this heart, as we described, has to pump blood through that open door into the vascular system. And a low resistance for that heart to empty is a wonderful thing. But if the blood pressures are raised, now the heart has to empty into a high resistance system.
Yeah, it works so much harder.
And like you go to the gym and you're muscular and you're well built, the heart does the same. So with that extra load, the muscle gets thicker. And a thick heart muscle, we call that left ventricular hypertrophy, LVH, is an added risk factor for end-stage problems. So a thick heart can sometimes then get a big heart, which we call dilated, and you can develop heart failure. There's also arteries of the heart called the coronary arteries. The heart has its own supply of oxygen delivered with these 2 to 3 millimeter diameter vessels. They get diseased by high blood pressure. And then you get down to the kidneys, and long-term high blood pressure untreated or not treated to goal. And we must remember that a third of patients who are on treatment are not treated to goal in their blood pressure.
So for me, what should my goal be?
That's another area where all the virologists and the different guidelines around the world have an argument. You know, that's difficult.
In your opinion?
In my opinion, I've got to wear two hats. If you wear a public health hat, especially in low income and middle income countries, then if you can get patients below 140/90 and get them there, you are doing a massive impact on the effects of blood pressure. On a one-to-one basis, as I would see you in practice, then my aim would be lower, 130/80. And I'm not discriminating a person in public health. If I can get the person in public health down to 130/80.
That's fantastic.
Exactly.
Yeah.
But if we're having a public health guideline as an aim, you would say 140/90 below. Otherwise, 130/80, and especially in somebody who's had evidence of disease. So if somebody's had a stroke before, or a heart attack, or has chronic kidney disease, or has peripheral vascular disease, or is diabetic,
all those risk factors, get them even lower.
you got to get them 130/80 or lower.
Well, Eric, this has been hugely informative. I hope people feel much more informed around high blood pressure and hypertension. I think to summarize some of the key messages, know your numbers in Eric's language, eat less salt, and make sure you're exercising regularly but on a moderate basis. Get your blood pressure checked and understand exactly where you are from that point of view. Eric, thanks very much for making the time. Great to see you. Thanks for keeping me in good heart health. All
It's
the
a pleasure.
best.
Thank you, Ryan.